Good afternoon and welcome to SOPHE 2021 DX Plenary number 2 for this afternoon. My name is Rafi Lukis. I'm a associate professor of health education at Penn State Harrisburg in Pennsylvania, and I will be the moderator for this section. Before we start this section, I would like to introduce Dr. Cam Coffrey. She's our SOPHE president who has a special award presentation at this time.
Thank you so much, Rafi. I'm looking forward to the second plenary. Today is kicking off to be a great day. This afternoon, I had the distinct honor of presenting Sophie's 2021 Honorary Fellow Award. This is the highest award by the Society for Public Health Education to an individual who has made an exemplary and lasting contribution to health education and to the public's health. Today, we present the award to Dr. Anthony S. Fauci, this distinguished award. This is a person who does not need any introduction. Dr. Fauci currently and has served as the director of the National Institute of Allergy and Infectious Diseases since 1984 and is perhaps known as the poster child of the COVID-19 health education efforts. He is one of the most respected and trusted health communicators for public health. Prior to COVID, Dr. Fauci was a scientific investigator and public spokesperson on HIV/AIDS, the West Nile virus, SARS, Ebola, and Zika, working under 3 different administrations. During the AIDS epidemic, he made major contributions to understanding how HIV affects the immune system and developing drugs to help prolong the lives of people living with HIV and advocating for research funding. During the COVID pandemic, Dr. Fauci has been outspoken in the need for sound scientific data to undergird public health response, as well as the need to adhere to basic public health guidelines. His calm but no-nonsense assessment propelled him to celebrity status as our country's public health doctor and helped our country as it has endured an unprecedented shutdown and conflicted with former President Trump's authority. For all these reasons and many more, SOPHE is honored to present Dr. Fauci with the SOPHE 2021 Honorary Fellow Award. As you know, his schedule is very demanding and he could not join us today, but he has accepted the award yesterday and recorded these remarks to share with you.
Dr. Escoffery, I greatly appreciate your kind introduction. I would like to thank the Board of Trustees of the Society for Public Health Education for selecting me as the 2021 SOPHE Honorary Fellow. I am humbled to be in the company of the many luminary honorees before me, and I accept this distinguished award with deep gratitude. For more than 36 years, it has been my privilege as director of the National Institute of Allergy and Infectious Diseases to help lead the biomedical research response to significant global public health emergencies, including HIV, pandemic flu, SARS, Ebola, Zika, and now COVID-19. As a public servant, let me briefly describe some guiding principles I abide by in carrying out this responsibility. First is fidelity to the truth, especially those truths revealed by science-based evidence and data. The public needs to hear the truth as it is rather than as either they or we as government officials might want it to be. Sometimes the truth means saying, I do not know. Secondly, transparency also is key. From past outbreaks, we know that we must earn public trust and then work twice as hard to keep it. Earning public trust requires us to be honest and open and not withhold information. We must make sure that everyone understands where we are going, what is the goal, and how we are going to get there. Third, we must communicate clearly to achieve understanding. Throughout my career, I have always been guided by the tenet, precision of thought, economy of expression. which has informed how I think, write, and communicate with the public. We must use language that everyone can understand. We also must be accessible to a broad spectrum of audiences via multiple traditional and social media outlets through which people get their information today. Finally, we must show compassion for those affected and protect the vulnerable. We are all in this together, and to prevail, we must pull together as a nation for the common good. Putting these principles into practice has been essential to building public trust in science as the pathway to resolving the COVID-19 pandemic and ensuring that the fruits of our research, such as vaccines, realize their greatest potential benefit and are distributed equitably. And so, thank you again for this distinguished honor. I applaud Sophie for the work you do to promote the health of all people through health education, health communication, and health promotion. You will always be an important partner in our global response to pandemics. Please keep well, continue your outstanding work, and enjoy the rest of your annual conference.
As you can tell, he was very worthy of the award, and we are also delighted that he recognizes the role of Sophie in health promotion and addressing both COVID and vaccination. I encourage you to get your Fauci ouchie. As we learned this morning, over 51% of our attendees at the morning session have gotten both shots, and I encourage you to work with your community to get the vaccination. I'm going to turn it back over to Dr. Ralphie Lucas for the rest of the session. Thank you very much.
Thank you, Cam. Today's plenary session will take the form of fireside chat, one of the national most influential leaders in healthcare. The coronavirus disease 2019 COVID-19 pandemic represents the greatest medical and public health challenge in decades. As a result, medical professionals, public health experts, health system leaders, as well as general public have scrambled to understand and respond to this crisis. Our plenary title, Leading the Way Response to the COVID-19 Pandemic, today will be to engage Laura Kaiser, who is the President and Chief Executive Officer of SSM Health, to engage with her in a conversation of how her SSM Health have responded, talk about her health mission and lessons that they have learned as they have responded to the COVID-19 pandemic. We will discuss some of the lessons, the result, the changes to U.S. healthcare delivery system, the role of partnerships and collaborations in developing an appropriate response to the pandemic, the importance of sustained efforts to address social determinants of health and health inequities, the role of health educators in the pandemic response, and the reason why bold leadership in healthcare is necessary during the national crisis. Let me tell you a little bit about Laura Kaiser. Laura Kaiser has 30 plus years of experience in healthcare strategies, improving clinical quality, fueling innovation, driving performance and growth, and leading changes while fostering a health organization culture. As I mentioned earlier, Laura currently serves as the President and Chief Executive Officer of SSM Health, a Catholic non-for-profit health system serving communities across the Midwest through the robust and fully integrated healthcare delivery system. SSM is headquarters in St. Louis, so we wish we were there with you today, but unfortunately we are virtually, and include 23 hospitals, over 290 physician offices, 10 post-acute facilities, comprehensive home care and hospice services, a pharmacy, benefiting companies, a health insurance company, and accountable care organizations. SSM, 400,000 plus employees and 11,000 providers are committed to deliver exceptional healthcare service to everyone they serve. Laura holds an MBA and a Master of Healthcare Administration from St. Louis University. She's a fellow of the American College Healthcare Executive and has been named one of the 100 most influential people in healthcare by Modern Healthcare magazine for the past 3 years. Everyone, please welcome Dr. Laura Kaiser. Laura, thank you for joining me today.
Thank you, Rafi. It's my pleasure and honor to be here with all of you.
Thank you. So again, welcome again. I would like the audience to get a better sense of the work being led by SSM Health. So can you tell us a little bit more about SSM history and the mission?
I'd be really thrilled to do that, but I'd like to just first start by saying it's great to be here with all of you. I do wish you were here in St. Louis. It's opening day this week. We all could have gone to the Cardinals game. It would have been great fun together. So we'll just need to do that at a future forum. And given that this is the National Public Health Week, it's just fitting that you're having your annual conference. So just really grateful to be part of it. I am the president and CEO of SSM Health, and I've been privileged to serve in this organization for the past 4 years. My anniversary is actually this month, and the 4 years have flown. We are a Catholic health system. As Dr. Lucas said, it is about an $8 billion organization with 41,000 employees. And we serve in Wisconsin and in Illinois, Oklahoma, and in Missouri, based in St. Louis. Our mission is to provide exceptional healthcare services, revealing the healing presence of God. And we endeavor to do that well every day, both with our employees in terms of the employees, including me, who serve at SSM Health, but also in collaboration with others that are endeavoring to improve healthcare in the communities where we serve.
Thank you. So as you've been dealing with this past year with the pandemic, what has been the role of SSM in the COVID-19 pandemic response?
Well, I should also say, I feel like we should just open up the mics and everyone can share their respective experiences, because I have no doubt there's a wealth of insight from everyone that's listening this afternoon. So I'll spend a few minutes talking about SSM's experience. And I understand you had the opportunity to hear earlier today from Dr. Alex Garza, who's one of my colleagues here at SSM Health, who served in the greater St. Louis area as the essentially incident commander for the greater St. Louis metropolitan area pandemic task force. So I'll tell you the story of SSM Health over the past year plus and how our work continues in the pandemic. And it may be that some of Alex's remarks will echo mine, because we really were in lockstep 24/7 for many, many days together, as I imagine many of you were in your respective communities. So when the pandemic began, Alex's background is a pretty unique one. He's been a member of the SSM team for a little longer than I, maybe 4.5, 5 years. And he came to us well prepared for what none of us really foresaw. I certainly didn't, of having a global pandemic hit. But he has a master's in public health. He is an emergency physician and was actually teaching in the School of Public Health at St. Louis University, and came to SSM Health as the chief medical officer. He also serves in the active reserves of the Army and has served in the Middle East and rebuilding communities, and has some really rich experience that's very germane to a pandemic setting. So in his role, he was paying attention, had accountability for infectious disease, et cetera, and was really paying attention to what was happening in China, in Wuhan, in the earlier days before it was really hitting broader airwaves. And so he and the team set up our early incident command center in late January. And we would talk a little bit about it, but it still seemed pretty distant at the time, and really came to the forefront when we were all learning more about what was happening beyond China and in the state of Washington and in New York City and in Italy. Our incident command took more shape in very early March. And like so many of you, I imagine similar type of situation in that we scrambled. We train at our disaster preparedness. We work hard to be ready when situations and issues strike. But we were not well prepared relative to having everything that we needed based on what we were seeing in other places, prepared for the worst, a surge like the locations I've already mentioned. We had a really hard time having adequate PPE. And I will tell you, having been in healthcare for many, many years, it really is the first time that I can remember in my own career of not being sure that I could keep the team safe. And that was horrifying. I'm actually a pretty good sleeper, for which I'm grateful, but I didn't sleep well for the first few months of the pandemic because there was so much uncertainty and because I was so concerned about making sure that the team was safe. As it turns out, all of us in healthcare have a lot of ingenuity and determination and creativity when you need it. And we took care of not having enough gowns by using some trash bags. We ended up finding masks from here and there. We were too dependent on a single supply chain, and all of us across the globe were trying to get all of these supplies, as you well know. So all of that is very SSM health centric. I want to talk a little bit more broadly because what happened, and we were doing this in each of the communities in which we serve, but I'm going to focus the balance of my remarks about SSM and the pandemic, principally in St. Louis, because something pretty extraordinary happened here. And that was early in March, as I mentioned, we were called, SSM and the other 3 health systems that are in this community, were called to a meeting at the St. Louis mayor's office on a Sunday, where we joined about 60 other people beyond the health systems, the mayor, the county executive for a few of the surrounding counties, the public health department leaders, the clinicians from the health system, business leaders, et cetera. And the reason we all came together was the elected officials were trying to identify what was the right number of people that would be allowed to gather publicly. Because all of us, including all of you, I'm sure, were scrambling to really sift through all of the information that was flowing. And the health systems, we have all competed in this market for a long time. We're Midwest nice, but we've competed. And competition is a good thing. It raises all boats. But in this situation, we really found that we needed to collaborate well together. And we went on a journey that remains to this day, I think, very powerful for the community. And it will hold true going forward in our efforts around community health. So the health system started to work together and share information, best practice. And we started to meet regularly, and we pulled together what became the pandemic task force, partnered with the public health department leaders, with the elected officials, with the business leaders, with the federally qualified health centers, so that together we could best serve this community and share information relentlessly. And we ended up sharing supplies, and we shared donations that came through. And the local media was really remarkable in helping us get the message out. And the role that all of you serve in public health, you know well about advocating and being a trusted advisor and a trusted voice in a sea of misinformation and confusion and basically fear. So the pandemic task force is continuing to function to this day. Dr. Alex Garza is the incident commander. I think based on the unique experience and skill set that he brings, the other health systems approached me and asked if he could serve on a broader basis beyond SSM Health. And of course, we said yes, and he's done that beautifully. And so we've gone all the way through from the early days of scrambling for PPE to testing and tracing and vaccine distribution. And we continue to remain together, meeting with everyone that I just mentioned on a bi-weekly basis, and the health systems meet weekly. So we're now moving into how does the world look beyond the pandemic? Because it's a bit chronic COVID, but there will be other pandemics probably, hopefully not, but we want to be more prepared than we have been. And how can we help in really starting to address more effectively together the different social determinants of health that we became even more aware of than ever before, and how do we do that better together? So that's a bit of a long-winded answer to your question, but it's just the story that has been.
So, I mean, that's raised some interesting points, given all the changes that the healthcare system have to go through to respond to the pandemic and struggle to accommodate, to change, to stop some of the services you offer and offer in different ways. What kind of lessons have we learned right now? Or do we just look at what was already there, some of the challenges that the healthcare system had to begin with?
So what lessons have we learned in terms of from the pandemic, if heaven forbid another one shows up day after tomorrow?
Yep.
Yeah, exactly. So I would say, I often ask my team, if you were king for a day or if you were queen for a day, what would you do? So none of us have that power, but it's a helpful strategic exercise to think about. And so we have done that, to think about some scenario planning. And I would say, if I were able to wave a magic wand and said, we're going to be doing this differently, it would be that we would act in even more unified fashion. I do think that St. Louis, we weren't perfect by any stretch. There's always room for improvement. but I'm very grateful for how well we all came together. And it wasn't always easy. This has been a very stressful time for everyone. But I think that our nation and the globe, we would all be better served if we had a more unified approach to help minimize the confusion and the misinformation. If we'd had a better way to have a single supply chain, had evoked the National Defense Act, et cetera, that would have helped save more lives, because there were, unfortunately, lives that were lost that should not have been.
And along those lines, do you think that the fact that a lot of the response was left to the state and the local governors, which that probably led to some different course of actions in different states, different areas, would that impact it, and what lesson have we learned from that situation?
For me, from my perspective, I think it's the same answer, meaning we serve in 4 different states, and we had 4 different approaches that were in play. The CDC wrote the guidelines around the vaccine distribution and then disseminated that to the respective states, who had their own take on that. And so in the state of Wisconsin, it was very proactive, and there was, just as one example, an effort to go out in a mobile way to find people for vaccine versus just having people come to different areas. In Oklahoma, it was a different approach around mask wearing. Was never required in the state of Oklahoma by the governor, and the same is true in Missouri. Illinois had a very different approach, and our footprint in Illinois is smaller. So I think if we were able to have a unified approach, I think it had to be incredibly hard for each of the governors to have this daunting responsibility as well. And so if we'd been able to work in a more seamless way, regardless of state lines, around some consistent approaches, we probably would have collectively served better. Now, I will say the response by individual caregivers, community members, and everyone leaning in together is nothing short of remarkable. I think I teared up the first time I saw the ads during the Super Bowl for the healthcare heroes, because it was so very well deserved. But I'm talking about a more systemic overall approach. The people that individually showed up deserve every ounce of credit that they've received and more. But I'm just thinking in terms of what could we do in a more systemic way.
Now, for a long time, the focus of healthcare has been in treating illnesses, as we all know, and that's been for the focus for the primary. In previous discussion and presentation, sometimes we heard that the people talk about creating health. So what can you share about what this means, and what can we do this? How can we achieve that?
So I'm an avid reader, and there's a wonderful book that has not been out all that long by Sir Nigel Crisp, who used to be involved with with England's National Health Trust. And he talks a lot about building healthier communities, and he talks a lot about creating health. I'm fortunate that I've had a lot of experience. It just means I'm old. I've been doing this for a long time, but I'm very interested in how to get upstream and help people live their healthiest lives versus just being available for rescue care. Our nation is probably the best in the world at having rescue care when you need it. If you've been in a motor vehicle accident, or if you've incurred some sort of trauma, or you have some very specialized need for care, we really do that beautifully. And there are other countries that do that as well. But there are countries that do preventive care and help people stay healthy in the first place better than do we, with far less resource than the United States has. And so what I'd like to see is we've developed a remarkable rescue care health system that I'd like to see some redesign around. As people's health needs have evolved, we should be evolving our health system so that we don't have massive health systems, but rather there are some of those, but we also have invested in communities. We've invested in preventive care. We do some of that well through public health, but we have underinvested in public health. And that's one of my learnings from this, in that it was very uneven from one state to another in terms of the funding that's available. And the public health experts are extraordinary and work very similarly to health systems individuals in terms of working tirelessly and very creatively with a lot of ingenuity. But we need to think about what type of health system in total do we need in this country. And that's one that I think is focused on creating health.
Thank you for that. One of the things that happened as a consequence of the pandemic has been this shift from, people going in person, delivery model, how we do healthcare, to this whole shift of people going, the federal policies that came to telehealth, patient system from, being in person to being in the phone or video visits. This whole thing of telehealth, telemedicine, a wider acceptance, and more people seem to be open to that idea and using it. So do you think this is an evolution that will have staying power?
Well, I certainly hope so. Prior to joining SSM Health, I worked for Intermountain Healthcare, and we did some innovative work in the earlier days of telehealth. And so when I joined SSM Health about 4 years ago, we implemented telehealth. So we've had that in place for now about 3 years. And before the pandemic, we were seeing about 200 patients a day with telehealth for preventive care, just for well check-ins, et cetera. And when the pandemic struck, we were the first in our communities to actually have a virtual screening tool online, and we shared that with everyone in the community. And we converted and shifted more of our ambulatory visits to virtual, because we shut off a lot of our deferred surgeries, deferred ambulatory visits, et cetera. But we stood up more of the telehealth. And we went from a couple hundred a day to more than 2,000 a day, like overnight. And one of the reasons that telehealth has not, I think, been adopted as quickly as its capabilities would suggest it should be is that the payment mechanisms for telehealth have not been embraced by a lot of managed care companies across the country. You've seen in the various communications around Medicare paying for telehealth during COVID and likely having that stay. Medicare and Medicaid are market leaders. More than 50% of healthcare is paid for through the federal government and state governments. So that's wonderful. And that's one facet. The other facet is there was some resistance by providers. It's a new access point. It's not a replacement, but it's a new way to access healthcare that in that type of setting is for a certain type of healthcare, whether it's a follow-up or it's something that is a lesser acute. You obviously can't have surgery done through a televisit. So sometimes you need to go and be in a specific site of care. But in the pandemic, all of that resistance to change and the uncertainty about, is this something that will work, by both providers and patients melted away. And all of the payers said, yes, we're going to pay for this during the pandemic. Some of that has disappeared, but I'm hopeful that as we continue to have conversations about what type of health system do we need in this country, what does it look like, I'm hopeful that telehealth, because it made a lot of inroads during the pandemic, is one of the good outcomes of the pandemic.
Good. That's good to know. So just as telehealth came into place, the other thing that came into discussion is this idea of greater focus on implementing strategies with health system to improve behavioral health. So behavioral health has been growing concern for many years, and even more evident than right now. So what insights do you have, or what we have learned when it comes and hopefully can lead to the health system better addressing the needs of public behavioral health and psychological well-being?
So behavioral health is, I think about behavioral health in terms of, it's one of the last bastions of stigma, unfortunately, in some ways. If I think back to the earlier years of the AIDS epidemic, the HIV crisis, there was a stigma around HIV and AIDS. That has dissipated, and that's a really good thing. And I'm hopeful that the same will be true for behavioral health. And I think that the pandemic and the stress that every single one of us as human beings was under revealed more conversation and some insight from millennials who were saying, I absolutely need some behavioral health support, and having some of the stigma of I'm supposed to just be a strong person and not talk about needing to have some help and some support to sort through what I'm struggling with. Mm-hmm. So I think at SSM Health, we are one of the largest behavioral health providers in the communities where we serve. And there are some statistics, I'm not going to get exactly right, but it was something about pre-pandemic in 2019, there was some sort of a national study where I think 1 in 10 adults are seeking behavioral health support. And in January of this year, it was reduced so that the number, instead of being 1 to 10, it was 1 in 4. So in other words, much more common. And we really saw that for our caregivers who were working in such stressful conditions and we provided a lot of support in the workspace. We have continued that. We've been using the Mayo Wellbeing Index to get a sense of the stress level for our caregivers, and we will continue to do that through the balance of this year, having the survey for the next 4 quarters, and then amping up on behavioral health support to make sure that we are addressing that, providing the support that's needed. And I think that that will also continue to increase in the community. It's very hard. It's very hard to have all of the behavioral health experts available. Psychiatrists are hard to find. We do have some wonderful psychologists and behavioral health social workers, et cetera, but it's a bit of a village around building the types of models and treatment sites that work. So there's a lot of work that needs to be continued across the country, but those are just some of my thoughts at this point.
Yeah, interesting. That's a really good point. Now let's do a little bit of shift on questioning. Long before the COVID pandemic, there was a whole widespread recognition of the persistent disparities in health outcomes in the United States by race, ethnicity, gender, identity, sexual orientation, inequities across multiple systems, structure, communities. So, we've been talking about the pandemic, and the shift that the traditional health system have done this past year. So let's talk a little bit about collaborations and partnerships. So we definitely know that improving health outcome among diverse racial ethnic groups require more of collaborations across different partners, multiple sectors. So from your experience of what you have seen this past year, how important are those partnerships in addressing these public health challenges like COVID-19 and, disparities and so on?
They're essential. Not one of us has all the insights or the resources to address how to best address health for all of us together. Years ago, I worked for Ascension Health, and I had accountability for community health. And we set up some very different types of community health sites. We called them community health ministries because it's a faith-based organization. And what we did is we went into each of the communities where we had previously served as a hospital, and we were leaving the community as hospital, as acute care, and staying behind to set up and address community health needs. And one of the things that I learned early on is, in order to be able to do that, you need to ensure that you have a really better understanding of what each community needs. You need to have the cultural competency, you need to have the awareness, and you need to go into any community where you're thinking about helping to improve health and learn from the people that live there, and to learn from people that are doing beautiful work in each of those communities, and figure out how you can be a part of the solution and to move on whatever those needs are that have been identified. The community health needs assessments are a wonderful formal tool, but a lot of it is about informal networking and meeting with key stakeholders and identifying what would really be most promising. And so that's what I think needs to happen. And in my experience, that's with public health partners. It's with other public organizations, private partners, et cetera. It just depends on whatever it is, whether it's a dental clinic or it's a food pantry or it's helping with affordable housing. There's a myriad of ways in which one can help in a community, and a health system is one ingredient.
Do you have any examples that you can share with us of a partnership that have worked well this past year, or what would have happened if that partnership would have been there?
Well, I'd love to tell you about one that was in existence before the pandemic and then has prevailed through the pandemic, because I think it's a fabulous example. And it comes to us from Wisconsin. We serve in a lot of different communities in the state of Wisconsin. This story is from Madison, Wisconsin, where we became aware of an individual, a gentleman that owns a barbershop, takes care of a lot of clients in his barbershop. He has 2 or 3 different locations, and I've never been a hairdresser, never owned a salon. So I do know, though, I usually end up talking a lot when I'm getting my hair cut to whoever's cutting my hair. And evidently a lot of people do the same, and they tell and if they've gone to the same person for many years, they end up talking a lot about them and they know each other well. Well, he noticed that he was having a lot of his clients confide in him about their health issues because he was cutting men's hair, and a lot of times men don't go to the doctor, and they are encouraged by the women in their lives, but they still don't go. And he listened to their stories and thought, I'm overweight. I have diabetes, I'm African American, and I probably have some things that I need to do to take care of my own health. So he took those lessons, those stories he was hearing, and applied them to his own life, and ended up becoming the first African American male who is a type 1 diabetic to finish the Ironman. And he is still a very fit human being to this day. And when he came back from doing that, he served as, one, a role model in his community, but he took it a step farther and put part of his barbershop, converted it into a health resource center that's chock full of great health information, educational information. He also added an exercise studio for his clients to be able to work out. He offers transportation to various health clinics and helps connect his clients to doctors so that when a doctor is needed, his clients will go. We are partnering with him on that. We did not come up with that idea. It was his idea, but it's a remarkable idea and one that's been very effective. So we're in the process of duplicating that, and we've been able to serve over 2,000 clients. And I expect we're going to do that in other communities, because that's a model that is one that can be replicated. So just one exciting example. It was really fun for me to be able to go and meet him and see what's been happening in Madison, and I'm excited about broadening that into St. Louis.
That's definitely a great example. I heard so many of those, but that's perfect. I mean, especially, he serves as a role model. I think that's key when it comes to his community. So one of the things related to that, as you work closely working with different kind of communities, what steps can health system take to ensure that they can serve as a trustworthy resource to communities, especially those who are negatively impacted by COVID-19 and health disparities?
So I think it's just to build on what I was just talking about. I do think it's the essence of trust. There's another wonderful book that was written many years ago by Stephen Covey called The Speed of Trust. It has 13 different elements of trust in it. And I think any relationship is based on a foundation of trust. And if you walk in as a stranger to a neighborhood, you work hard to build trust and be alongside people so that when you leave and come back, you're no longer a stranger, you become a neighbor. And so as a health system, I think sometimes we can be big, we can be scary, we can be a place where someone's had a bad experience. And so I think we need to go in and find others, as I mentioned before, that are already in the community, and just walk in a very humble way with really big ears to listen to what people are willing to tell you, and to find out how we can be of help to advance the health of the community. The best intentions are essential, but it's more than that. You have to find a way that you're a trusted partner, because if you don't have the trust, you're not going to be able to help that community. It's not going to work.
That's definitely a good point, especially now when we're talking about trying to provide vaccination for a lot of these communities. And if that trust is not there, they might not be willing to come to you to receive that service. So that's definitely a key point. Now, responding to the COVID-19 pandemic has required contribution from a diverse field of health expertise and specialization. Especially today, we have an audience of public health educators, public health education specialists. So health educators are professionals trained to change behaviors, environmental and communities, healthcare system, and schools, colleges, other settings, with the goal to promote disease prevention, reduce disease burden, and addressing health disparities. So in your opinion, is there a role for the health educator in the COVID-19 public health response?
Oh my gosh. I think health educators have been central. And there are formally titled health educators, but I'm going to broaden that because I think of the public health experts, of which that's part of the role. But Alex has served as a health educator by being the trusted incident commander. I think he's done more than 160 press briefings. They've included some of the public health educators and leaders, the physicians that are part of the public health departments. There's just, it's just been essential because this has been a public health emergency. And so in our own organization, just to keep it small within SSM Health, our health educators were in every one of our incident command settings. We're actively looking at health policies, and we were modifying them, sharing best practices as we learned more about what we were all grappling with, and then help to disseminate that across the organization so that employees would have that information to keep both our employees safe and those we were serving. So I can't think of the pandemic without the health educators. It's just too central.
So moving forward, do you think, what would be the role of health educators out there? We have advocacy, we have communication, we have, public health education, we have all these different roles. So moving forward, you think that we have to have a key role in all these situations, whether it's another pandemic or another health crisis?
So I think that the role of advocacy, health promotion, education, I have a hard time separating any of those. What I'd like to see, and as a health systems person, so I went to graduate school at St. Louis University that has both public health and hospital administration. It's actually stronger in public health today than it was when I went through many years ago. And I had colleagues, classmates that were in public health, and I had some classes in epidemiology, et cetera. And when I think about now, for the past year, working very closely with public health, again, I would like to see more of a connection, an ongoing connection with the health system providers and public health, and all of us, because we collaborated so well, it better serves the public. And so I'd like to see public health more funded. It's very uneven from one state to another. And it's one of those things that is an essential. And I think people just rely on it like a utility until it doesn't work or until it's not there because it hasn't been funded. So to me, there needs to be ongoing advocacy. We need the public health experts in those various rooms where those conversations are taking place to be subject matter experts. And I think it will be more powerful to do that together with health systems and other elected officials. I think the health promotion speaks for itself. If you think about hearing Dr. Fauci just a couple of minutes ago, he's been a trusted voice for the American public. I've seen Dr. Garza be that similar type of voice in the St. Louis area. And I think that promotion is also just kind of tied together. So there needs to be a continued role that's growing in prominence with public health.
Thank you. Laura, across all the comments you have made, one of the things that's clear is that in order for us to meet the enormous public health challenges, bold leadership is required. So based on your experience, what would be characteristic of bold leadership required to lead during difficult times as this?
That's a really great question. So I would say, I think one of the things, we're a Catholic-based organization, and so I've been very inspired by the nuns that began this organization 150 years ago. And one of the things that I think about when I think of them showing up on the shores of the Mississippi almost 150 years ago is they didn't have a guidebook. They didn't have a recipe for what they were going to do. They just felt called to serve. So they showed up on the shores, took a look around at St. Louis, being this fur trading community that was growing, and saw a lot of people that had different kinds of communicable diseases, including smallpox. And they decided just to show up and help. And they looked around and saw what I would, and we would today call social determinants of health, and just kind of dove in. And their Mother Superior had a phrase that she would say often, which was continue courageously. And so I think that bold leadership requires courage and a willingness to just move forward without all the information, because you're just never going to have all the information. None of us had all the information we needed in the pandemic. But what we did do was we took what we had and we kind of pooled our collective intellectual and physical resources and leaned in together to face the crisis. And I think that's what bold leadership requires. You have the confidence that you'll find your way through it, but the humility to know that you don't have all the answers and you have to find your way through.
Thank you for that answer. I have a couple of questions from the audience. The first question is, what does the current data, if any, show in terms of the impact on communities of color for telehealth, digital health? And do these communities have challenges using the system? And how can those challenges be addressed? So there's three questions there in one.
Yeah, that doesn't seem quite fair. Let's see.
Well, the first question, what is the data, if you have any data on the impact of community of color when it comes to telehealth and digital health?
That is still unfolding for us. And so we, like, I think, unfortunately, so many communities, and again, I'm going to just talk about St. Louis. We have been partnering with the FQHCs. I think that Bethany Javois Johnson was one of your speakers earlier today, and she was talking about Ferguson. We still have some real inequality, inequity, healthcare disparities. And what we have learned, our telehealth was not deep into the different zip codes where there would be some of that socioeconomic disadvantage, although most everyone has a cell phone these days. And so if we can get into the communities to share with people how this works, and it is something that continues to be a going concern, I think that acceptance and utilization will only increase. It's just still too early around the overall universal acceptance of telehealth by the payers, if that's going to continue. But it's something that we need to continue working on. And it is actually one of the things that the health systems have been talking about together as we look forward.
Yeah, that's a good way to address some of those issues. Definitely, you're right. Everybody have well, not everybody, but a lot of people have cell phones. And if we can at least teach them how to use the cell phone to connect through some kind of a telehealth system, that would be a great way to bridge that gap in many of these communities. I have another question from our audience. What are some of the skills necessary to be a leader in usual situations compared to emergency situation like the pandemic?
I think a lot of the skills are transferable, but I would say in the pandemic or an urgent situation or emergent situation, everyone's wired a little bit differently. I think about physicians in different specialties. What makes an individual become an emergency physician versus a primary care physician or infectious disease? Emergency physicians, and I've worked with physicians my whole career, a lot of emergency physicians are they're decisive, they move quickly, they can compartmentalize their work and move on to the next patient. If you're an internist, you're taking care of a patient over a period of time and looking for trends. And I think in an urgent situation, you need to be decisive. You need to keep your cool. You can shake later, but you need to be collected when you're in the middle of a situation. And so I think that's what the pandemic has required. And probably not coincidentally, Dr. Garza is an emergency doc. Our next incident command leader for the pandemic in SSM, when Alex went to that role, also is an emergency physician. Didn't look for that, but that happens to be who those two leaders, where those two leaders came from. So I think it's really important about that calm, collected, measured response while you're being decisive. And I think that actually translates well, whether it's an emergent situation or a longer term situation. I think you also have to be able to look around the corner in terms of, let's look at what the implications are. If I make a decision here and I open that door, does it open a window over there? Or is it just opening this door? You have to be able to think about what the implications, what are the consequences a couple steps ahead. If I do this, what happens? Because if you don't do that, you might make what is a really great decision on its face value that actually has really bad consequences farther down the path. And so you need to be able to think about that, and that may inform your decision either to keep it or to modify it.
Along those lines, the next question also referred to leadership in crisis. And, there's specific, you talk about some of this already, but there are specific guiding principles when it comes to the short term. How do you deal with a crisis versus long term vision of moving forward? And does this principle change over time, or would it change over time as things change?
I'm not sure I understand the question. Can you repeat it?
It says, as a leader in crisis, what are the most important guiding principles for short and long-term vision? And does those principles change over time as a pandemic or a crisis unfold?
I feel like what I said before still applies.
Yes.
And I think it just kind of matters. It's interesting. I've had a number of different roles in my career. I've been in this seat now for 4 years, long enough to live with the results of my leadership and that of the entire team, because I'm one of many leaders here, and we are a team. But it's interesting. I then get the longitudinal view of, was that a good decision 4 years ago? Or versus just being here for a little while and saying, oh, it looks really great, but you don't get to see the consequences. So I think it's a little bit situational. And the way that you can really test that and identify for yourself as a leader is, to look at decisions that you've made and see how they've stood the test of time. Or even if they've stood well, is there something that you might have done differently if you had known X or Y? Because you're going to learn more as time goes on. But I think my earlier response around being decisive and thoughtful and looking around the corner applies.
Thanks. We have a different question. You talk about the barbershop experience that you have and how wonderful that is working in that area. Do you have any other type of community linkages that we can foster as health educators?
Other examples?
Other examples of other things that, other type of linkages that we should be working on as health educators, like that one?
Sure. So when if I go to I'll go to another community from a previous experience when I was serving and had accountability for New Orleans. This is a little bit older example, but it's one that I think is powerful. We had a community health ministry, which was a couple of clinics that were primary care clinics in socioeconomically challenged communities. Katrina came along and destroyed those two clinics along with so much other devastation in New Orleans, as we all know now. And so we had the opportunity to reevaluate and decide if we wanted to rebuild what we had or if we wanted to do something completely different. And what we came up with was a mixed response. I went down to New Orleans a year after Katrina had hit, and I naively thought, nothing's happened. This place is a mess, because it was a complete mess, but it was my own naivete in that there had been a tremendous amount of cleanup work that had already been undertaken. The devastation was just that great. And so over a 10-year period, I was able to see the health of the community return. And it was through the good works of countless numbers of people. And for the organization that I was leading, we had a leader on the ground where we ended up collaborating with the mayor of New Orleans, many other publicly elected officials, other health systems, and with local parishes and with churches. And we ended up taking one church that was no longer working, or was no longer a church, but it was still the physical structure, and converted it into a PACE program for seniors, which is an all-inclusive program of daycare for seniors. We built a dental clinic because dental care is so essential to overall health care. We opened a food pantry, and we also had a child care center. And that was all based on conversations that we had, more than I can count, with the local communities where we were considering serving, and we were being asked to serve in many different places, and we only had so much resource. But we did that through a lot of listening and talking with others to see who could partner with us. And it ended up today, I've lost track now because I've been away from it for several years, but it ended up becoming a much more vibrant ministry than it even was before. And it was because of the way that we went about it, I think.
You just mentioned a few minutes ago the Ferguson Project. And so this morning we also heard from the speaker about the racism in St. Louis, the legacy of Ferguson, the vision that they have moving forward for St. Louis. So how is SSM working to address this, or working with them to address this, or help the city move forward?
Yeah, it's a great question. So I will tell you, I was not here in St. Louis when, unfortunately, Michael Brown was killed so many years ago. But I live here now, and I was born and raised in St. Louis, and so I watched from afar when that happened. And this is a city that does have some racial polarity, and there are a lot of us that want to see that change, and a lot of us are leaning in to do just that. But it's a tall order, and there are some specific zip codes. Ferguson is one of them that needs a lot of help, and there's a lot of really good work going on, and I'm sure Bethany talked about that. The Urban League is very involved, and there are a number of different partners. We have a pediatric clinic in Ferguson, and we are now looking at what else can we do. Another of the health systems has an ambulatory clinic, a primary care clinic there, and there are dental offices there. But it's one zip code of many. There's another that is called Jennings that has needs. And so we're in the early stages of figuring out how do we best serve, because we are one of two health systems that already were in that area. And we will continue to be.
Thank you for that. We have another question from the audience. What do you think the relationship between your health system and the Department of Public Health would be post-pandemic?
I'm expecting to stay connected. So I had the good fortune to meet for St. Louis County a woman named Spring Schmidt. Kelly Volmar is in one of we think of them as collar counties because St. Louis crosses over into Illinois, and then there's a bunch of collar, kind of a little circle, semicircle around. So each of these leaders are extraordinary. We're losing one. Dimitri from St. Charles is going to Indianapolis. So Indianapolis, if there's anyone on the phone or watching this, you're about to get really lucky that he's coming your way. And so we will miss him. But I'm expecting that as a health system leader, I and my team will stay connected. I've asked Dr. Garza to become our Chief Community Health Officer. And certainly the pandemic is about community health, but it's so much broader. And so his new role of Chief of Community Health will help to identify how do we work more effectively together. Barnes Jewish Christian is another health system that's here in town, Mercy Health and St. Luke's. And we've all talked about what makes sense in terms of, yes, we are going to compete, but we're going to collaborate wherever it makes sense. And that includes collaborating with the public health department leaders.
Thank you. I just have a question myself. I know President Biden just announced that, we have this big effort making sure that everybody who is able to and want to receive a vaccination will have it by April 19. So what is the role of SSM is playing on this, and what kind of efforts are you doing in different communities that you're serving, because you're so large, to make sure that, we are able to successfully meet that goal?
So probably like many other communities, we're no different. But it has varied a little bit from one state to another. So maybe this is a little unique. We are part of a high throughput model from the state of Missouri in the eastern part of the state. So in the St. Louis area, the 4 health systems plus the St. Louis County Public Health Department are considered high throughput. And so we have been receiving vaccine directly, and we have been working our lists. We thought the fairest way to take a look at the very limited supply in the earlier days of vaccine availability to work the list based on age. So we started with 75 and above. We all have Epic as our healthcare record. And so we were working our own patient profiles because we figured patients had their homes and their respective health systems. And so we've been working the list. It's now come down to 65 and above. And for people with comorbidities, that's one facet. The public health departments were also receiving small numbers of vaccine originally. And then it's been opening up. There was another facet of long-term care facilities receiving vaccine directly to take care of seniors that were in congregate housing. That's all changing now because the supply, thankfully, has been increasing. We just had a pandemic call yesterday, and we were talking about there are some mass vaccination events that have been occurring in collaboration with the state and the National Guard. And we were just talking yesterday about how do we know, as we're trying to get to people that have yet to receive the vaccine, how do we know in these age cohorts who hasn't gotten vaccine yet? Some of the data is lagging. The data it's hard because this is such a large project. But for example, of 75 and above, we think collectively we've reached most people, but there are certainly some that we haven't. And so it may be because there's a reluctance to receive the vaccine. It may be because someone's housebound. And so there is some outreach to go into homes, but there needs to be more clarity on who remains that needs to be vaccinated. And then for people that are reluctant to receive vaccine, what types of messaging, what are the vehicles, what are the channels that we can get to people? Because to speak with someone that's age 70 plus and talk about convincing might be completely different than talking with someone who's 15. Mm-hmm. So we're talking about those messages and how, and that pandemic task force involves the FQHCs, involves the health systems, the public health departments, the elected officials, the business leaders. So we're all thinking about this and figuring out 8 times 8 ways. The Institute for Healthcare Improvement talks about 8 times 8 ways is how we're going to be able to reach the rest of the population.
Well, thank you for that. As we almost concluding this chat with you, is there any final closing remarks that you would like to provide us?
I would just like to thank each one of you for all that you have done throughout this pandemic, because I have no doubt that there are heroes that are listening today, and I'm so grateful to each of you. And I fear that for some of you, you've put your own self in harm's way, because at least from what I saw in some of our communities, the public health officials ended up being a bit of a target for some really bad behavior by others. And for those of you where that happened, I'm profoundly sorry, and I empathize with you, and I'm so grateful that you stood tall, you continued courageously, because this is something that is important for every single one of us. Our community is the world. We are global, but we are all in this together. And so I'm just so grateful for everything that each of you have done. Thank you.
Thank you, Ms. Laura Kaiser, for your time. And on behalf of the Society for Public Health Education, again, I want to thank you for taking your time for your very busy schedule. I'm sure you're so busy with so many facilities and so many people you have to oversee and work with and partner and so on. So we definitely, again, thank you for your time and talking about this important issue and how SSM is doing, helping our communities and helping the San Luis area and some of the other states that you're working with. And it's definitely showed that hopefully we're taking health back, and we are probably moving to an era that the health system will look a lot different from what it was maybe a couple of years ago because of the pandemic, that we will look at more of this, creating health, creating more of a preventive approach, including more of the telehealth system and be able to have all of that in place. So definitely do a better service for all the different communities, whether it's the all or the child or in between or different race, ethnicity, and so on. So again, I want to thank you for joining us today. I believe that we're going to move in a few minutes. We're going to be moving to Dr. Bill Potts, who has some announcement for us.
Hello, everyone, and thanks so much, Laura and Rafi, for that terrific presentation. I'm here today as president of the Foundation for the Advancement of Health Education, and FAHE has had a long-term relationship with Sophie, announcing our awards and providing support for other projects in the health education profession. FAHE has been around since 1992. It was started by a group of leading health educators who thought there was a need for a vehicle to develop projects and receive bequests and other gifts that might be able to support the advancement of health education in our country. One of the most important things that we do is provide scholarships, fellowships, and awards. The recipients will be announced on Friday during the plenary by our Vice President, Dr. Donna Vidito. So we encourage you all to join us at that time to get those recipients. Another important FAHE project is our sponsorship of the SOPHE Eduthon, which is an exciting renewal of the student competition that many of you are familiar with. The winners of the Eduthon will be announced during tomorrow's awards session, and we encourage everybody to show up for that so that you can celebrate with us the recipients of the Eduthon prizes and also the other SOPHE awards. I'd like to introduce now a short video which talks a little bit more about our relationship between FAHE and SOPHE and the Eduthon itself.
This competition that incorporates health education competency and a unique adaptation of technology or social media. Graduate and undergraduate health education student teams will compete in presenting a response to a challenging scenario that demonstrates their health education specialist competencies, uses of technology, and emerging methodologies. Each member of the first place team will receive an $150 cash award, a SOPHE Award certificate, recognition, and an opportunity to present their innovative winning approach during a future SOPHE webinar. On Thursday, April 8th at 5:30 Eastern Time, all conference attendees are invited to watch the 72nd Annual SOPHE 2021 DX Awards Ceremony during the conference. You can find the awards ceremony in the conference schedule. Don't forget, your colleagues can also watch the ceremony through our live stream on YouTube. On Friday, April 9th, the plenary Whole School, Whole Community, Whole Child Framework, Challenges and Future Amidst COVID-19 begins at 2:30 Eastern Time and starts with the announcement of the FAHE Awards. Be sure to take part in Sophie's Twitter chat happening during the session. Thank you for being a part of SOPHE 2021 DX. We're so glad you're here.
Thank you, Bill, for the announcement.
SOPHE 2021 DX.
Okay, and again, as they say, just keep track of the SOPHE Award ceremony coming up later this week, and stay tuned for that. As I think this pretty much conclude our plenary section for today. We make sure that you have your continuing education credits. If you want to do so, the evaluation for this section will be available in the next 48 hours, and then you complete those to earn your CECH and any other competencies you need. Make sure that you go back and complete that after this session, again, in the next couple of days. Go back to the platform and you'll be able to complete that. Next. Again, thank you for joining us, Sophie, for this presentation. Next section, we start at 6:15. I guess we have the dance party, so make sure you get your shoes ready and enjoy the dance floor in the accommodations of your living room or your house or whatever you're located at this point. Join Sophie in celebrating this evening. And thank you again for participating in this plenary section on SOPHE 21. As always, follow us on social media at SOPHE.org, SOPHE Tweets, SOPHEgram, and SOPHE Health. For those of people who are love to do SOPHE Tweets, please tweet out there. Everything you see about the conference is doing great, and always include SOPHE Tweets as part of your tweets. And with that, I think we're concluding these sections again. Once again, thank you for joining us, and thank you for your participation in SOPHE 2021. Thank you.